Hello everybody, my name is Dr. Harry Kunelis and I'm a neuromuscular dentist with a focus on TMD and chronic pain related issues, specifically of the head, the neck, and the lower jaw. Let me take a moment to tell you a brief story of a 40-year-old male who had a job-related injury at work where he fell from a 25-foot ladder and landed onto an iron beam. And for a quick second, take a look at this picture of his head sometime after the fall here. This 40-year-old young man was an otherwise very fit individual. Up until becoming an iron worker, he was an Army Ranger doing special ops missions for the United States government chasing drug cartels in certain parts of the world. So needless to say, this individual really was in very good shape and was now suffering from a true traumatic injury. He spent, at this point, between insurance dollars and his own dollars in the last 12 months, $75,000 at a well-known headache clinic with no results, in fact, negative results. Additionally to that, he has commented to me that he's lost a little over $100,000 in lost work wages and overtime. He hasn't worked in 12 months due to the chronic head, neck, and back pain issues that he's been having from this injury. Every time he starts to move around, the symptoms of headaches, neck aches, and migraine come back immediately. He was referred to me a few weeks ago by a physician that has a specialty in spinal manipulation. And the reason he was sent to me was to address the jaw-related issues and the changes that are taking place in the jaw following the manipulations that are taking place in the spine. So as one can see again, here is another perfect example of where the team approach, the secret to treating these difficult cases, is able to get people back on the right track. Now this is an ongoing case. We haven't relieved his symptoms entirely, but what we have been able to do within a 7 to 10 day period of time is allow him to start sleeping better. He was sleeping for the last year with a neck brace or a neck splint that was holding him in a position that wouldn't cause additional headaches during the evening hours when he would wake up in the morning. So at this point, with the spinal manipulations, with the co-treatment of the splint therapy, with the neuromuscular dentistry approach, we're able to start getting this individual to be sleeping better, which over time is going to allow the healing mechanism to come back into play. And hopefully, within the next several months, we'll notice not only an alleviation of the symptoms, but a complete elimination of the root cause of the problem. So what I'd like to address in this summary is the team approach and how the chirodental approach, an approach where the jaw and the spine are being treated together at exactly the same time to allow accommodations to take place. So if you'd like more information, at the right of your screen, please click and we'll be able to give you more insights onto the team approach and the chirodental approach in the future. Thank you.